Hey guys, this is Dr. Hub. Today we'll look at the myeloma. So under the myeloma, we are going to focus on the prognostic factors. So what do they contain? So firstly, let's look at what is good. So the good prognostic factor, prognosis, is when there is hyperdiploid. When there is hyperdiploid. So what do you mean by hyperdiploid? It means that there is T11 as well as 14. Then there is also the T6 and 14. So there is the cyclin D1 or the D3 positive. So all this forms a good prognosis. Now what about the poor prognosis? So in terms of the poor prognosis, it includes the T4, 14. Then there is also the MAF. This is the translocations. Next there is the T14, 16 and also the T14, 20. Then there comes the DEL, this is 17P. Then comes the aneuploidy, and the hypoploidy, this hypoploidy. Next, there is an elevated beta-2 microglobulin. There is an elevated beta-2 microglobulin. Then comes the LDH, that is a lactic dehydrogenase. Then comes the C-reactive, that is the C-reactive protein. And there is also plasma cell, this plasma cell proliferation. And then comes the bone marrow infiltration. There is also the bone marrow infiltration. So what are the other prognostic? That includes the plasmablastic, this plasmablastic morphology. Then there is also the abnormalities. This is by the conventional cytogenes. There is a cytogenetics. Then comes a plasma labeling index. There is a plasma labeling index, and this is greater than the 3%. Plasma labeling index greater than 3%. Then there is a serum creatinine levels. The serum creatinine levels. So this is going to be greater than 2 mg per dl. Then we can look at the bone marrow biopsy. The bone marrow biopsy, it includes the diffuse and the prominent. So this diffuse and the prominent. This prominent. This is the angiogenesis. And there is also presence of the low serum albumin. There is low serum albumin.